The title Invest Now, an Action Plan for Seniors Living in and Around Terrace Bay is the title which I'll credit to Charles, actually, since mine was something boring like what happens with seniors in Terrace Bay. There's really two parts to what I'm going to present. Part one actually deals with long-term care facility, and I'll talk there first about what's needed. I'll show you a little bit of the population data that supports the view. This is all in the report that you have, and introduce the notion, the costs of funding questions, but that's up to you to discuss as much as you want. So that's more an opening for you to ask questions. The second part is really one slide, and it's about supporting aging in place. And one of the results of all of the reading and research I did is that what your citizens want, your senior citizens and those who will be senior citizens, is to be enabled to age in place and to have a community that supports them in doing that. Now it's up to you guys how much you want to take on of that. So I've separated it as a different part of the discussion. Now let's see if this will go down a page. So we'll talk about the long-term care facility. This is very simple. The recommendation that comes out of looking at the population demand for long-term care is that you need to double the capacity at least as fast as you can, and that you will need to triple the capacity by 2031 at the latest. That's just to almost meet the demand in your community. That doesn't get ahead of it. It catches you up, essentially. The other question, how best to do it? Well, I don't think there's really much question. If you can get North of Superior Healthcare Group to expand, to twin the facility they have, that's the fastest and the most effective way of proceeding. It gives you a nonprofit partner, and your role in that is to be negotiated. So that's a simple set of recommendations, and I'm sure you've all seen them. Where does it come from? This graph, this figure, includes census data by 5-year groups from 2016 and 2021. And this is basically the data we have, the best data that we have. So how do you read it, and what's it going to tell you? Well, the first thing to notice is that the white bars outlined in gray, or are, if they're above the blue, are the 2016. If they're below the blue, you'll see a little black line that just indicates where the 2016 was. Whoops, sorry. So what does this tell us? Well, first of all, because the blue in the groups 60 to 64, right through to the end, is higher than the white bar, it means your seniors population has increased from 2016 to 2021. That is not news, obviously. There are some other bits of information in this that are quite interesting. One of them is the big drop that you're seeing in the 50 to 54 groups from 2016 to 2021. Those are 5 years out. So those are the ones who will be over 60 and close to entering the seniors category in 10 years. Similarly, the other white bar here, these two high bars say that they've moved forward to 2021. They move forward. You can expect a rise in the 2026 census. That's what we're looking at and extracting from this figure. Again, it's not hugely, Well, actually, there's a great deal of information in it, but the key point is we can see what the difference is from one census to the other. And that information is the best information we have about the retention of seniors in your community. So, what retention means is what fraction of the group, for example, the ones that were between 60 and 64 in 2016, ended up 65 to 69 in the following census. So we're looking at the jump from that level to this level. And that turns out to be a 90% retention rate. That is 90% of the people who were just before retirement age were still in the community 5 years later. That's the number that we think is interesting for trying to figure out how many people will be there in future years. Now, I've taken those numbers and I've calculated them for each age group. I've said, oh boy, lots of sort of bouncing around in that. So let's smooth it out a little bit. The second line is just smoothing it because we don't expect one 5 year group to be retained at the same rate as the next 5 year group. We expect that to sort of smooth out over time. And then I've compared it to national rates and said, does this smooth set of retention rates derived specifically from Terrace Bay population correspond in a sensible way to the national retention rates? Well, you can see that consistently the national retention rates are higher. So does that mean I'm sorry. Does that mean I'm underestimating retention? No. What happens, obviously, if someone moves out of Terrace Bay to, say, Southern Ontario, they're still in Canada. So they're retained by Canada, but they're not retained by Terrace Bay. So you would expect Terrace Bay to have a lower retention rate than the national rate. Some fraction of your seniors move elsewhere. So that's the basic data that everything is built up from. Now, what does it tell us? The first thing it tells us is you should expect that the seniors population is going to rise between 2021, the blue, when we had actual information, and 2026, when the next census comes. Now, obviously, that's just next year, but I don't have that data. So I had to estimate it. And this is what the applying that set of retention rates does. It shows us you can expect an increase in seniors in the next census. Again, not much of a surprise. What the real information in there is that there are numbers that we can add up. Feel free to stop me and ask any questions you want. But what happens if we push it out to 2031 and 2041 using the same technique based on the Terrace Bay population? Well, this is maybe a bit of a surprise. What happens is, look at the first column on the left. You can see that those entering into the senior category declines between 2026. It was close to 150. Now it's just over 100. And 2031. Let me back up just a bit. No, I want to go that way. Remember, we were at 150 in 2026 was my estimate. Now we're just over 100. Why is that? Sorry. Darn it. This thing is so sensitive. Why is that decline? Well, because you have a shortfall of people in the 40 to 55 range right now. You have a sort of hole in your population, which has a lot to do with the sort of hiring pattern at the mill and people holding their jobs for a long time, and therefore you're not attracting a lot of workers of intermediate age. So they're not coming through anymore. 2031 drops, 2036 is even lower, 2041 is even lower. What you see then is a kind of bump that gradually moves through the age groups. So it's easy to see with 2041 because it's on top of the others in this graph. By 2041, the largest group of seniors you have will be 75 to 79. They won't be newly entering that category. They'll have been around for a while. Well, you can see pretty easily that the numbers decline later on. So let's just add them up. What's the total number over 65 we have in 2021? The census said 380. The simple projections that I've just shown you are the column here called no mill. And this is just assuming that your mill does not restart and hire 300 people. What you see is the number rises to 447, peaks in 2031, which is where that number came from. This is the number you have to deal with by 2031, and then starts to fall. Because there's always some hope that that mill is going to reopen. I imagine you all hope it will. I created a couple of models where the mill hires a lot of people who are older, and it hires a sort of standard distribution of population to see what that mill hiring would do to the numbers in the seniors category over the same period. And what you can see pretty clearly is you end up with some larger numbers farther out, primarily farther out, because of course new hires are going to be younger and it's going to take them a while to get into the seniors population. What I'd say about this is please don't put too much trust in numbers after 2031. And secondly, if you look at these numbers, the model I use, the assumptions I use don't make a lot of difference. I can change those retention rates a little bit. I can change the hiring pattern in town a little bit. And these are still going to be pretty close to what I'm giving you. So please don't take even one number in this, including the Census Canada number of 380 as 100% reliable. But please take them as pretty good estimates, maybe the best estimates you can possibly get given the available data of what's likely to happen. So that doesn't solve our problem because knowing how many seniors there are doesn't tell you how likely they are to need a senior's home. And it's the real question is how many of those people will need a senior's home. So what I've done is I've looked at the literature, I've looked at the age groups as much as I can and come up with some percentages at each age group that are going to need a senior's home. Now the low number means not many people between 65 or in the 65 to 69 range go into a senior's home. But for people who are over 100, basically all of them do. That's between 100 and 105, basically all of them do. Those are approximations consistent with Canada data and American data. They're a little rough. Nobody really has much better numbers that I could find. For a good reason, populations vary a lot and small community populations vary a lot. But if we take those numbers and apply them to the number in each age group, so 20% of those between 75 and 79 will want to be in a senior's home or need to be. So we take that number, if it's 100, we say 20 need. Sorry, I did it again. we say 20 need a seniors home. So we can use these probabilities and the estimates so far to generate how many, how much demand you have for long-term care in Terrace Bay. Well, the calculation gives us 56 for 2021. The data you have 22 long-term beds, and there were 31 on the waiting list last year. That gives us 53, very close estimates. So what that suggests to me is that this method of calculating is giving us the number that want long-term beds. I've got to keep my hands off the keyboard while I'm talking to you. And I can't seem to do that. All right, so all the models are the same, but the really interesting numbers are the no mill column, the number who want long-term care in 2026 is going to be 67. That is almost, well, that is 3 times what you have, which suggests you've got to really push if you're going to satisfy the need of your citizens. It keeps rising. 2031, it's 70. That's more than 3 times, which is where the 2 numbers come from that were on that first page. Double it as fast as you can, double the supply as fast as you can, and triple it by 2031. After that, well, the numbers keep rising. Sorry, did it again. They do keep rising until 2036 when they start to fall. But the period that you've got to really worry about is the next 5 years. And defining demand as the number of seniors in your community who will probably want and need long-term care is going to triple. That's the big result. So then you might want to talk about costs and how you get it. Municipalities very commonly make contributions to operating and costs for staffing and enhanced services for non-profit operations. Non-profit operations provide far better service. They have fewer fatalities. People are more satisfied than for-profit run operations. You have a non-profit operation, and it makes sense to expand it. How much of a contribution do municipalities often make? Well, as much as $10,000 to $25,000 per bed per year. I believe that you're actually making smaller contributions than that in Terrace Bay, and that might be the target you might set if you're entering into discussions to encourage the health team to twin their facility. I can't really tell you how those negotiations go or what you're going to do about that or what you want to do. I'm just trying to give you sort of a scale. Did I miss a page? Oh, yeah. I want to tell you what kinds of costs. Recent industry reports suggest that the cost for long-term care facilities can exceed $500,000 per bed. So if you're talking about adding 20 new beds, you're talking about $10 million, someone finding $10 million. Now that's done with a mortgage, and the province actually provides money per bed. It doesn't pay it up front. Most of what it pays is in a kind of, sorry, I am not used to something here. It pays a grant to get it underway for non-profit operations. And then it basically pays your mortgage. It pays a certain amount every month for 25 years. So that's the logic of paying for them. The province is committed to providing this service, but not taking all of the responsibility off of local communities. And if the local communities don't take it up, the province is willing to go with the private sector, despite the fact it's known not to provide as good a services in general or as healthy a living situation. So that was the comment on municipal contributions. I must have skipped too quickly. If we talk about what Terrace Bay residents want, you had a survey done. We know that a quarter of your population right now is already seniors, and that's rising. We know from that survey and from other surveys in Canada that people really don't want to go into long-term care. They don't want to. People in Terrace Bay said they do almost anything to avoid going into long-term care. The National Institute for Aging reports there were 70 times more deaths among older Canadians living in long-term care and retirement homes than among older Canadians in the community. Now, there's two things happening there. Sicker people go into long-term care, but people stay healthier longer at home. The data is very clear about that. And this is where each community gets to decide if it wishes to take on satisfying people's desire to stay in their homes and the improved quality of life that they get from it. Now, at only 25% of the vote, I guess the seniors can't push this entirely politically. In any case, that leads you to the question, well, what do you do to support and promote aging in place in your community? Because that is what your citizens want. And there's a list here of things that you could take on. I don't know if you want me to read this, if you want to talk about it in detail. I'm not going to talk about each of these right now. My sense is if you want to discuss the question of how you modify your community, what projects you take on to support aging in place, that's an important discussion, but it comes after dealing with the long-term care problem, which is pressing right now for you.
You said there was 31 people on the waiting list.
Yes.
I know that, say Terrace Bay built this in 22 or 44 beds, whatever the case may be. I don't know if you know if those 31 are all from Terrace Bay, but what I'm saying is the people in long-term care, not everyone's a Terrace Bay resident, and not everyone that gets in there is going to be a Terrace Bay resident, because I think the government says who goes in there, because I know when my dad was in there, there was people there from Scriber and Marathon. So I don't know.
Absolutely. Two things you need to know. That's the waiting list that the province had from residents in Terrace Bay, that number. So it is attached to Terrace Bay. Second, if there is not a place in Terrace Bay, they get assigned another home somewhere else. Mm-hmm. That's the way they're working it. If you don't take it, you lose your spot, go down the list. So at this point, yes, when an opening comes up in Terrace Bay, someone else might be assigned to it. And when somebody needs home long-term care in Terrace Bay, if there is not an opening, they go somewhere else and they don't have much control of it.
Yeah, absolutely. Any other questions from council? No. No, hearing none. Thanks for the presentation, Dr. Robinson.
Okay, thank you for the opportunity to do this. I found it very interesting. I hope what I've given you is helpful. And I understand you have some very challenging decisions to make around these questions. So good luck with that.
Okay, thank you.
Charles, anything to add?
No, I think you've got a challenging situation, as David said. I think the important thing to take away, of course, is you've got an urgent question right now. You've got, but it is temporary, and I think this is one of the things that I know when I was talking to John and others early on in this project, that the real worry was overbuilding for the urgent demand. So you've got to balance it. I think David's highlighting the fact of expanding the supports to stay at home really is going to be a critical piece of the overall solution. So thanks again for the time. And as David said, we're always happy to answer other questions if you have them after the council session this evening or anytime going forward.
Thank you.
Take care, everybody.